I trained in surgical oncology following my general surgery residency, which means that I spent 2 years following 7 years of general surgery learning just about cancer. Once I finished my training, I actually decided that I really wanted to focus exclusively on women who are dealing with breast cancer and other diseases of the breast. So for the last 20 plus years now, I've been taking care of patients exclusively who are dealing with breast cancer and other concerns. One of the things that I think makes me unique is that during my residency, I took time off and did a master's in public health and spent time looking at surgical outcomes and health services research. So that means that my research was really studying how we deliver care to patients. I think differently sometimes about systems of care and how we make sure that the patient experience is the best that it can be in the ways that we design our systems and our processes. My approach to patient care is to make sure that I remember that every patient comes to their diagnosis with their own separate set of experiences, their own values, their own interpretation of how it's going to impact their life. And so my job really is to provide as much information as I can and to walk each patient through making the best decision for them that is consistent with their values, their experiences, and what they hope for their future. I wanted to become a doctor because it seemed like a job that would be incredibly fulfilling and satisfying, and the idea that every day I could go to work and help somebody else, especially in a time of need, was very appealing to me. I chose UNC Health because of the mission. I think it is really unique to be at a state institution that is dedicated to serving the population of the state. We really view it as our job to make sure that all of the patients across the state can access the health care that they need. The other thing that's really unique about UNC that appealed to me was the way that the health system is integrated into the university. It allows us to really be able to not only participate in the education of the next generation of doctors, nurses, and other healthcare professionals, but also to participate in life-saving research that's advancing the field. People might be surprised to learn that my husband is also a surgeon. He actually works over at Duke and has a number of leadership positions there. We have 3 kids that are still in school, and we really love living here in Chapel Hill because it allows us to really be able to integrate our home life with really productive and fulfilling careers.